Hello, welcome to Building a Successful Infant and Early Childhood Mental Health Consultation Program. I am Stephen O'Connor, the Program Manager with the Department of Behavioral Health's Healthy Futures Program. In part one, we will discuss building the foundation, and I am joined by three colleagues, Monique Douglas, Megan Sullivan, and Deb Perry. Megan, what do you think is essential in building a foundation?
Thanks so much, Stephen. I think one of the core components of building a successful foundation is relationship building and collaborating partnerships. So it is extremely important to, rather than just build it within your own entity, to collaborate with other system leaders. And so within DC, we've spent significant time really working with some of our other government sister agencies who also focus on early childhood and the importance of early childhood education, as well as building strong partnerships within the child development centers themselves. So we spend time working with the teachers as well as the teacher aides, but also the center directors. Without having collaborative relationships, it's nearly impossible to get the work done. Everybody focusing on early childhood education and working together to build that ground foundation is essential.
Thank you, Megan. To piggyback on what you were saying, I'm going to talk a little bit about hiring, onboarding, and supervision. We hire independently licensed mental health clinicians. We find that to be an essential background for consultants, even though they're not doing direct service. Shadowing has been one of the key elements of onboarding, going into the centers with a seasoned consultant and seeing how the work is being done in the classroom. We get a lot of training, but we focus on equity, being trauma informed, and also self-care and mindfulness. We provide reflective supervision, both individually and in group. Monique, what do you see as essential?
I felt that as a consultant, when I began, it was very important for us to learn the consultative stance. With that stance, there were 10 areas that we focus on. So when we had that stance, we educate the new staff on those 10 guidelines. But I felt that when I was a consultant, centrality of relationships and avoiding the position as a sole expert was important to me. Working with the teachers and the directors in the classroom really laid the foundation. I provided the mental health education, and the teachers showed me how to be a consultant in reference to the classroom and what a classroom looked like and how the day-to-day interactions was to take place. So us working together made that a great asset to building the capacity and also that relationship.
Great, thank you, Monique. Deb?
Yeah, I think I'm here because I've been your longtime evaluation partner, and we in DC made a really strong commitment to using data to both build the program initially and then also for sustainability and expansion. So 13 years ago, DC Department of Behavioral Health had a really strong commitment to integrating high quality data collection into the ongoing operation of the Healthy Futures program. And then as an external evaluator, I was able to bring some additional expertise to develop reports that were very influential to policymakers, and I think really laid the foundation for the expansion that the Healthy Futures program has seen over the last few years. So thanks for including me today, Steve.
Yeah, you're welcome, Deb, and thank you all. This is really interesting and very important. Thank you.
Thank you.
Welcome to part two of Building a Successful Infant Early Childhood Mental Health Consultation Program. In part two, we will be discussing expanding without drifting. And I am joined by colleagues Monique Douglas, welcome back, Danielle Goldberg, and Dr. Leah Subhit. Healthy Futures is actually offering its consultation services to all child development centers in the district that accept subsidy. We're also really excited to be including treatment as part of our services. Monique, what do you think is essential in building without drifting?
Yes, for this part of the expansion, really focusing in on 0 to 3 is our main concern. So really providing support to the consultants, it was very important. Allowing the consultants to feel comfortable in this age range was kind of shaky. So how are we working with the consultants to look at the lens of an infancy and toddler classroom, providing them talking about attunement, attachment, how do we see these things within the classroom? So really giving them that education and then seeing it firsthand in the classroom together with the teacher is so important. So building a relationship, how we always talk about building relationship through our consultative stance. This is important through that infancy and that toddler classroom, and we're strengthening these areas every day.
Yeah, that's so important, Monique. Thank you. And you had me thinking about what I had mentioned in part one about hiring and hiring qualified clinicians to come in to provide consultation, people that can come in that have a solid background in early childhood development and mental health, and also have the type of personality that can connect with people, because we know how important relationships are. I also want to mention the importance of evaluation, having an outside entity come in and evaluate the program and help us from drifting from the primary work of consultation, I think is really key. Danielle, what do you see? You have come on board as a supervisor specifically for the expansion.
Yeah, thanks, Steve. This has been such an exciting time to join this program. As we've been sharing with the expansion, we're able to reach more centers and provide consultative services. And we're also really responding to the needs of the community. We've been seeing an uptick in community violence impacting our centers, the teachers, the directors, the children, and we're able to provide a crisis response at the centers, which has been, I think, a really healing and helpful space for the communities that we're serving. As part of that, we're also supporting our consultants by providing individual and group supervision to make sure that they have a space also to heal and provide quality services.
Yeah, that's great, Danielle. Thank you. Dr. Subhit, you have come on board specifically to help us build the treatment pilot. What have you seen in your work so far?
Yeah, thank you, Steve. Healthy Futures Treatment Pilot Program is a direct response to and a result of the needs of the community, as we have all shared. As consultants have continued to serve the evolving needs of the community through prevention and intervention, they have also recognized a desire for a more nuanced approach to services. The Treatment Pilot Program is a holistic avenue of outreach that provides therapy to children and families directly in the child care centers within the community. Therapy services also work to collaborate with and enhance the established work of our consultation services within the child care centers. Treatment specialists provide a confidential quality therapy to children and families just as if they were going into a clinical office setting, except now the services come to them. Thus, this bridges the gap between the barriers to seeking clinical interventions and the need and desire for clinical interventions. Additionally, the clinical treatment specialist will work holistically within all contexts the child resides in: families, caregivers, teachers, school leaders, consultants. And this is an effort to create a continuous collaboration of treatment services. And all our clinicians are provided with supervision specific to supporting early childhood mental health and their families.
Well, thank you, Dr. Subhit. And thank you all for the work that you do. It's appreciated. Thank you. Hello and welcome to part 3 of Building a Successful Infant and Early Childhood Mental Health Consultation Program. In part 3, we will be discussing creating positive partnerships. And I am joined by my colleague, again, Monique Douglas, Michelle Reuter from United Planning Organization, UPO, and Lisa Torres from the Office of the State Superintendent of Education, OSSE. Monique, why don't we just jump right into it? You and I have been here with Healthy Futures since the inception, some 13 years ago, and have worked a lot with community partners. What do you see as essential?
Yes, hi. Thank you, Steve. I think our consultants have been doing very well collaborating with RC as well as with Quinn, UPO. We work really hard in working with the family engagement workers and also the coaches while we're in the classroom. So I really try to stress the importance of the relationship building with those teams, and we do a lot of teaming together on seeing how the classroom is. Are there any concerns in the classrooms? What are the strengths of the classroom? And we all work together with the directors and the teachers, the UPO staff as well, to make sure this partnership is in flow and it's working well. And it's been going very well.
Yeah, thank you, Monique. You know, you actually had me thinking about the importance of communication. And I think that's one of the things that has really stood out to me over the years is how important consistency in communication is. So having those community of practices, having our collaborative meetings monthly, getting together, having our consultants join the teams at UPO, Michelle, right, to sit and talk about what's happening at the centers and in the homes. It really helps us deepen our work with the district's families. Michelle, what do you think about what's essential with community partnerships?
Hello, and thanks, Steve. Yeah, I'm Michelle Reuter, and I'm the Senior Project Director with the United Planning Organizations Hub through the Office of the State Superintendent of Education's Quality Improvement Network. We have collaborated and worked closely with the Department of Behavioral Health's Healthy Futures team for many years now. And Healthy Futures has really partnered with us to support with social and emotional needs of the children and family that we serve at the centers. The partnership between our two programs supports our comprehensive services team, most notably through our family engagement. The consultants will work with our family engagement specialists and early learning specialists to identify children with social, emotional, and behavioral concerns in the centers. And the consultants with Healthy Futures will periodically support with developmental milestones, mental health, safety, and self-care trainings for our families and staff during each program term, which in turn really supports the continued success of our program and families as a whole.
Yeah, that's great, Michelle. Thank you. Lisa, what do you think is essential for building positive partnerships?
Hey, Steve. It's a pleasure to join you all on showcasing our partnership with Healthy Futures. My name is Lisa Torres, and I am the Program Manager for the Quality Improvement Network and Early Head Start Child Care Partnership Program, locally known as the QUIN. We serve 366 children across 14 participating child development centers and 16 child development homes. And while we do many great things, as you stated, I want to focus on our partnership with Healthy Futures. We successfully promote children's mental health, social and emotional well-being, and overall health through our partnership. But beyond the work that we do with our educators, our families, and children at the center level, our partnership with Healthy Futures is successful because of the intentionality of our partnership, our collaboration, and the way that we serve as thought partners for each other on systems level work related to policies and practices in the areas of health and social services. Through areas like our Interagency Steering Committee, we ensure effective coordination and support of children and families. We address program-specific challenges or areas of improvement. We coordinate and strategize our activities and initiatives, share successes and challenges, and identify needs and supports. Our collaborative efforts have resulted in a robust staff wellness program, impactful prevention program for children and families, linkages to mental health service providers, access to resources and education on mental health, and revised program goals, with wellness as a critical piece towards the foundation of our work that will guide our efforts for the next 5 years.
Lisa, thank you. And thank you all for the work that we do together for the families in the district. It's appreciated. Thank you all. And it's been our pleasure to present this topic to you all. I hope it has shown a little bit on how to build a successful consultation program. Enjoy the rest of your day. Thank you.
Thank you.